Hey, it's me again. All right, so we're on objective number 2, which is about how's this money flow. So, if you remember, we talked about the healthcare dollar. I've got this money coming in. I've created these budgets. So now let's talk about the puzzle pieces that come into healthcare. And this is really where we're going to identify some of the important aspects that in your mind are going to help you answer future questions about what do I do. Number 1, let's take a look at the network. The network is a group of healthcare providers, nurse practitioners, doctors, hospitals, ancillary providers, everybody. And I've got a network. This is where you hold your managed care agreement. This is where the reimbursement Exhibit A, Exhibit B of the contract that defines what you're going to get paid resides. The network does not pay claims. The network does not confirm eligibility. They're merely a group of doctors that you've signed contracts with that you can come in and say to an employer, or a health plan and say, hey, I have a network of 340 doctors. I've got them all at discounted rates. Would you like to buy access to these discounts? Perfect. The insurance group is the one who says, I want to buy access to those rates and discounts because I'm the one that has the checkbook that the money is coming out of my bank account. I'm the one that's holding all those premium dollars, and I've got to spend those premium dollars. And so for me to pay premium out to doctors, I need a network that is going to give them discounts. And of course, the network's going to say, well, the discounts are justified on volume, so I need you to send me a lot of patients, or my doctors in my network are not going to be really happy. So the insurance group funds the payment of the claims. They may buy reinsurance for a shock claim because if a transplant comes along, big cancer case, life flight lands on the roof of the hospital, those are type of shock claims that the insurance company is going to buy insurance for. And they're the ones that will seek discounts because they don't want to pay bill charges, that's for sure. The network will give the discount. Well, does the insurance group actually process the paperwork? No, the group that does that is called a third-party administrator. Third-party administrators have to be licensed. Thank goodness. This is the group that will process the claim. They will use the money from the insurance group checkbook, but they're the ones with the big computer system. They apply the benefits, the $5,000 deductibles, they adjudicate the claims, they manage appeal on claims. They're the ones that do all the paperwork. They might write the check, but it's not their money. The money's coming from the insurance group. So the insurance group has said, hey, third-party administrator, I need you to pay claims when they come in. Third-party administrator, how do you know how much to pay the doctors? The network. The network is defining that you're going to get $1.25 for a service. Third-party administrator is going to apply the benefits of that plan, pay you the $1.25 using the insurance group's money and checkbook. But wait, we're missing a box. Did you have authorization for that service? The medical management group is going to say, hey, this patient got admitted, nobody ever called, we didn't get to babysit it, we didn't get to do case management, there was no prior authorization, so I don't really care what the contract of the network says. The service required authorization to have that MRI, that CT scan, that admission occur, that referral to the specialist had to be blessed. Unless that happened, that third-party administrator is not going to use that insurance group money's checkbook to write the bill. So you've got 4 big pieces of the puzzle that make this happen. It is so easy to understand when it's Aetna, because Aetna has the network. Aetna has the TPA license. They have the medical management. They're the ones that are also the holder of the risk. This is a health plan. They have all 4 pieces. The network offices may be on the 3rd floor. The third-party administrator and claim processing folks may be on the 2nd floor. Medical management might be on the 8th floor. The insurance risk might be out of state. But they're the ones that are doing everything. However, within the everything, these 4 sections still exist. That's important. What if we don't have a health plan? What if we have a fully insured insurance company? The broker came in and said, hey, John Alden's going to hold the risk. John Alden has a relationship. They're going to use the nation's largest PPO network called MultiPlan. The third-party administrator we're going to hire to pay all the claims is Pfizer. And then the medical management is going to be through the care group that's accredited health utilization management group. Well, wait a second. Now I'm confused. When it was Aetna, I just sent everything to Aetna. Aetna took care of whatever they're going to take care of. But now you've got this card that showed up in my practice, and I don't even understand it. Well, what's you need to understand is, where's the claim being sent to? Fiserv. That's the address on the card. You never hold a contract with Fiserv. You'll never hold a contract with John Alden, because that's not where you hold contracts. Where do you hold contracts? And y'all better be sinking in your mind right now, the network. MultiPlan. That's the contract. Now, is MultiPlan what you're capturing and picking in your practice management system in your office? If you have a good running office, by God, I know you are. But so many people will pick Fiserv and say, oh, I've got all this Fiserv business. They're a TPA. That's not where your business is coming from. The business is coming from the network, and the network is still backed into the employer. Because in this case, the employer's chosen John Alden. I still want to know, with MultiPlan, which employer through John Alden came to MultiPlan for me, back to my scenario in the first section. So now all of a sudden it's starting to get a little tricky. Well, what if we move to a model where it's self-funded? Tyson Foods. Actually, they use Cigna, but I'm using this as my example. Tyson Foods is the employer. They said, you know what? I'm keeping the $358 employee-only premium. I'm going to put it in a bucket, and if I control risk in dollars, I might have some to spare at the end of the day, and instead of Aetna, Cigna, United generating those profits, I'm going to keep that extra money. I'm going to keep the 15% admin, and I'm going to keep the savings. But even as an employer, being Tyson Foods, I know I better go find a network that can get me contracts and discounts to healthcare services that by providers. I need a TPA. I need people that are licensed that can process and pay the claims and process them using my money. And we all know I'm not going to do it without, the mother may I of medical management that says, did you get authorization? Do you have approval? Did you get 12 visits? Did you get 4 visits approved on the ancillary side? Got to have that medical management piece to help control and ensure medical necessity and that we're not providing services or paying for services that aren't medically necessary. But wait, Great West is in both buckets. That's perfectly fine. They have the network. They also have a TPA license. No problem there, but you got to understand which bucket you're talking to. If I want to do a contract, if I want to get to Tyson Food employees, my contract's going to be with the network. I know my claims are going to go to the TPA. I'm going to hope the TPA has properly loaded the contract of the network, which in this scenario, by gosh, I hope they would. They're the same company. And we also hope that medical management's feeding the right data over to Great West, third-party administrator, to pay the claim at the network rate using the Tyson Food money. Wow, I just said a lot in that sentence. Goes back to the 4 squares. Got to identify it every scenario when you sit down and look at an insurance card at your front desk and go, whose is this? Great West, Tyson, I got a third-party administrator on here, I got a lot going on. Always comes back to the 4 boxes. So, check that out. We've now moved on to our second objective, which is understanding the key elements of the health plan insurance puzzle, the structural foundation. I know the money comes in and I have buckets, but how those buckets now work are the 4 pieces of the puzzle. And knowing I've got a network where I hold my contracts, I got a TPA that's just a processor of stuff. The insurance group actually funds the claim. The actual checkbook, they're funding the checks that are being written. And I got a medical management group going, yep, you can do it. Nope, can't do that. Yep, you can do that. So the TPA, before they pay a claim using the insurance group's money, paying the physician or the nurse practitioner at that network contracted rate, are going to go over there and say, hey, did you approve them to do this? That's how the puzzle pieces come together. So with that, we get to end the second objective of Module 1. We have one more objective in this module, and this first section will be done. So thanks for hanging in there with me.